experts look at what can be done to help you live a longer and healthier life. They take a number of non-medical factors into consideration. And joining us this morning to discuss all of this and the social factors that impact healthcare is Dr. Alex Billioux from UnitedHealthcare. Good morning, Alex. Thank you so much for joining us.
Good morning. Thanks for having me.
Well, let's jump right into this. What are some of these social factors that impact health, and how do they factor into the work you do?
Sure. Well, social factors is just the technical term for things that we rely on every day, like adequate housing, food that's healthy, transportation, but also things like education and employment. So it's not too much of a stretch for us to imagine that those things have an impact on our health and our ability to manage, medical challenges that come our way. But what we want to highlight is actually these factors have a much bigger impact on your health than access to doctors and hospitals.
All right, so what do we know about how these social components create different health impacts for different demographics around?
Sure. Well, as you might imagine, people in the lower economic strata, people with lower incomes, are usually the folks that are going to face these problems. But frankly, these needs cut across all demographic groups. And one of the groups we wanted to really highlight today are older adults who often can suffer from these challenges or having these needs, but maybe suffer in silence and not be as open to sharing that they have a need. So at UnitedHealthcare, what we've done is we've actually screened 4.7 million of our Medicare Advantage members last year and found that 1 in 4 had an unmet need and wanted help with that.
Well, interesting numbers there. So when we look at people struggling to access food, housing, transportation, what are the most effective ways to improve the social factors?
So for us, it can start with connecting members to their benefits. So helping, we have assistance with food, with transportation, helping navigate the housing system. But importantly, what we try to do is connect people back to resources in their community, like community food banks or churches, or even government programs, things like local programs for weatherization. Those are all really critical helps that we can connect our members back to, but they also help to connect members to their communities, helping with social isolation as well.
All right, especially during this time of the year, always tough. Dr. Alex Billioux from UnitedHealthcare, thanks so much for joining this morning.
Thank you.